Morning, everyone. Welcome to this week's Cuppa Club. Hopefully you are grabbing your coffee and you're ready to talk to us today and chat and interact with us on our excellent Cuppa Club lineup. Really excited to introduce you to some of our participants. I'll just wait for a few more people to join and then I will make the introductions. So today, you could say, is a Cuppa Club sponsored by FX and Mind for You. And it is part of the Dementia Awareness Week. So following on from Mental Health Awareness Week last week, really important subject and one which perhaps is not talked about enough. So really interested and excited to listen to the perspectives of some of the lovely ladies that I've got on the panel with me today. So let me kick off and just do a bit of housekeeping. So we will have a chat today between us. It will be about 45 minutes. I will be having a discussion and there'll be questions asked by myself, but also feel free to ask questions via the chat function. I'll pick those up throughout the course of the conversation, or I'll try and answer them and direct them to who's best to answer them at the end of the session. This isn't a financial promotion anyway, and we cannot answer any questions relating to specific financial circumstances. So I'm very happy to welcome the panelists today. So as I mentioned, we're going to be talking about Dementia Action Week. So we're going to be talking about how we can support and help reduce the problems facing unpaid carers of people living with dementia around the UK. So COVID has caused many problems, but it also robs many carers of their lifelines of day and respite care, which provided an important break from caring. And this has led to family carers experiencing really extreme isolation, depression, insomnia, and exhaustion. And research from the Alzheimer's Society has shown that people with dementia and their carers have been one of the worst affected communities in the pandemic. And 95% of these important dementia family carers are reporting on even more negative impact on their mental or physical health. And a shocking statistic that's emerged is that 40% of family carers carry out this work for more than 100 hours per week, which is more than double the legal work limit in the UK. And they obviously have to keep this up for months on end with no prospect of a break or a holiday, which is really tough. And today we're going to talk about what the problems are, what the challenges are, but also to introduce you to Mind for You as well, who are working on providing holidays for those with dementia and their carers as well. And they're currently live on the FX platform, so you can read more information about them there too. So let's, without further ado, go to the questions. So if everyone would like to give a little wave when I say your name, and you can just let everybody know who you are. So first of all, Carol Sargent, founder of Mind for You, an organisation that specialises in providing stress-free breaks for people living with dementia, their families and their carers. We have Barbara Stevens, who has supported people living with dementia and their families as CEO of Dementia UK for 12 years and now as CEO of Dementia Pathfinders, an innovative dementia kick. That's a community interest company for those trying not to use acronyms. Stephanie Bowman, welcome to you, a current carer of her husband Graham living with dementia. Jean Totti, a former carer of her father who had dementia and founding director of the Life Story Network and Tide, together with Dementia Every Day. And Tide was established as a new carers involvement network and it operates across the whole of the UK. So without further ado, let us kick off the discussion. And I'm going to come to you, Carol, first to just talk about what is the problem that we find ourselves in today in terms of the role of unpaid carers in the UK for people with supporting people with dementia and other debilitating illnesses?
Thank you, Lisa. I think firstly, thank you, FX, for hosting the webinar on Dementia Action Week and giving myself and the other panelists the opportunity to really discuss those important people that are often invisible, those family carers who generally don't even see themselves as a carer. They're supporting their loved one, generally husbands and wives, but can be all sorts of other family members and friends. But those are, for that person who's living with dementia, they are their absolute rock. And you know what we're speaking about today is who cares for those carers. And that's what I don't think we all understand as a society, just how much these individuals aren't just supporting their loved ones, but they're supporting the whole society in us being able to access all the really, really important health, you know, during the pandemic that's critical. But it's these people, you know, and to me, one of the really interesting facts, if you look at who spends the most money on supporting people with dementia, believe it or not, it's not the health service, it's not the social care service, it's family carers. And I think we just don't understand, you know, how much time, how much, you know, people put their lives, you know, on hold, and, you know, how people find actually, you know, I'm that husband. Suddenly roles have changed and I'm that carer with a huge amount of responsibility for my loved one, but there's nobody really there to support me. Nobody's really taught me what to do. I'm doing the best I can, but gosh, I would really like to have more support. And, you know, that's one of the things, you know, Dementia Action Week this week, you know, it's signing a petition for Cure the Care System. And there is a very, you know, hard-hitting video that really exemplifies what life as that family carer, as somebody with dementia, can be like and how challenging it is. So to me, today is about sharing what that life is like, but also the group that's here have a huge amount of experience, and it's sharing the ways we can all support, you know, the family members, the friends, even the people we meet when we're, you know, out at the shops, yeah, or just having a walk in the park, just to understand the little things that will make that difference for the person with dementia and for that family carer that you see needs that extra little bit of support.
Thank you, Carol. And Stephanie, if you could give us your perspective as a real life carer at the moment and how you find that. If you could just unmute, Stephanie.
At the moment, I'm lucky. I live 2 doors away from my son and his family and about an hour away from my other son. And both help me out. And just from this month, I have been able to employ carers to come 3 days a week for 5 hours. But the problem for me has been, you would think that with 5 hours free, I'd be sort of getting up and going and doing things, but actually I was in a complete daze at suddenly being free. And I almost didn't know what to do with myself. Now, this is amazing because this was a positive thing that I've got people from this month coming 3 days a week, and yet I still found it really quite difficult to have some get up and go. And I'm just about starting to get there now. But it's taken a long time to get to this position. And basically, initially, my worries were, well, what will the future hold? Now, because it's my husband I'm caring for, I don't have to worry about being a long way away from my husband. And I didn't have to worry about giving up work. And my husband was already retired. So that was an enormous, enormous help. The finance is another thing that can really weigh on you, because although social services will provide services free and they'll provide incontinence products free, they aren't always the best that you can get. So really, it's just even now when I've got help, you're still worrying about day-to-day things, how you're going to manage, and whether you're going to be woken up at night because something goes wrong, and whether you've got a wet bed. And also, all of a sudden, like Carol said, you are responsible for everything, for running the place where you live, for getting enough food, medicines, looking after a person medically. And you have some hard decisions to make, really hard decisions to make sometimes. Should we go for medical examinations, and then if we find that something's really wrong, that it just isn't practical to go ahead. And you're almost making life and death decisions sometimes, which is really hard. Or even if it's not life and death, you're making decisions, physical and financial decisions for that person, that are sometimes really quite hard to make, especially when you know the sort of decisions that the person you're caring for would make, but you don't feel that they're the right ones. And so there's a sort of psychological problem in all this.
Yeah, so thank you, Stephanie, for your insight. And yes, Jean, if you want to come in there.
I think both Carol and Stephanie have given us a really good introduction there. Thank you for that. And I just coming back to Stephanie, I think at the end of the day, carers are the biggest workforce in dementia care, more than the NHS and social care. And you cannot underestimate, as Stephanie has just alluded to, that responsibility as you advocate for the person you're caring for. It's a massive responsibility, and it sort of occupies all of your time, doesn't it? All of your living, your waking time as the dementia progresses. And what we do at Tide is give carers the opportunity to use that experience to influence the decision makers. Now, they may be local services, commissioners of health and social care locally, or it might be national policy. But it's really important that those decision makers for local services and national policy understand the impact of dementia on the carer, because the carer can become a patient themselves because of the stress and their own well-being suffering as a result of this, as Stephanie, I think, has really just outlined very well. And what we aim to do is give carers the knowledge of how to work your way around the systems, for one thing, because it's so complex. But general members of the public, unless you need those services, you don't bother about understanding health and social care because you don't need them. It is so complex about who provides what or doesn't, as the case may be, and you fill the gap. But you find yourself, as needs increase, actually spending a lot of time coordinating that care and coordinating different professionals. So you become almost a care manager or a care coordinator for the person that you're caring for. And that is incredibly difficult and stressful. For example, I'm supporting on a personal basis a carer who is travelling 200 miles to care for her mother every week for 3 days. So that's a 400-mile round trip. Well, our mother has got advanced dementia and lives at home, but the money that she gets from her direct payments from the local authority only funds 4 days of care. So she has to travel all of that way to go and care for her. And finding carers with experience of dementia and training in the field of dementia is yet another problem, because there's such a turnover of them. If you're from a diverse community who does not speak English, that's even worse.
Yeah.
So there are big implications for people from different communities as well.
Thank you, Jean. And Barbara, coming to you, how has COVID affected this situation? And you know, I assume this is, as we said, you know, made the situation a lot worse. What are you hearing from people and families?
I think what has been illustrated by what Carol has said and what Stephanie has said, and reinforced by Jean's comments, is that for carers, this is completely all-consuming. Caring becomes everything. And I think with the diagnosis of dementia, if the diagnosis is made early, then the person with dementia can sort of contribute, and it can feel like, well, we're in this together. And as dementia progresses, and I think a lot of people really don't understand that dementia is a progressive condition over many, many years, then the family carer, the primary carer, and particularly if you're a spouse, then more and more and more you're on your own. You become more and more and more responsible for all the decisions, everyday decisions and big decisions, just as Stephanie is indicating. And where carers find support, it's often from other carers. And I think what COVID has done has confined people to their own homes, has made it much more difficult for family carers to meet other family carers. And it's really compounded that sense of isolation. So a family carer might feel very isolated in a relationship, but they're also isolated from support structures that are available in communities and other family members. So extended family have not been able to visit, have not been able to provide support in the way they usually would. So I think it's really compounded that sense of isolation.
And what support would normally be available for families and carers?
Well, as I say, carers, certainly in my experience, and having been a family carer myself as well, talking to other carers and gaining support from other people in a similar situation. I mean, you can be sure that of all the challenges you face, somebody else somewhere would have faced a similar challenge. And you know, family carers are the experts in their own situation. Everyone's dementia is different. Everyone's situation is different, but there are some commonalities. And those challenges, it's incredibly helpful. Just the practical everyday sort of tips and ideas, as well as the emotional support that's provided by people in a similar situation. So those peer groups, those peer networks, I think are incredibly helpful for carers.
And what could be done to, we're going to come back to Carol in a minute to talk about a little bit more about what, you know, what she does to help support carers and those with dementia, but what could be done to bring more support to individuals and families? Jean, would you like to take that one?
Yes, I think from my experience of being in this field for many years, and prior to having a family member with dementia, I worked in health and social care all of my career, none of which prepared me for caring for my dad. But I think we have an issue with how local services are commissioned for families affected by dementia, because an awful lot of commissioners in health and social care do not really have the in-depth understanding of what dementia is. And yes, it is only one of the conditions that they have to provide services for, a wealth of health and social care. And they might say diabetes and stroke and heart disease is more important, but actually dementia is the biggest killer in this country, because it is a long-term terminal condition. And a lot of our commissioners, from my experience, having worked with them, do not have that understanding of the impact of dementia and the different types of dementia on that individual, because it is unique, as Barbara's just said, to every family, and the impact on the families and how families are actually providing that workforce. So for me, there's something about using the stories from everybody who's spoken today already. That experience of carers' unique experience should be valued and actually fed into planning local services. And that's where I think we were making some progress about 8 or 9 years ago with the dementia strategy, but it's gone backwards, in my experience right now, and it's been compounded by the pandemic. But actually it was starting to get a lower priority just before the pandemic. And right now, I believe that our services are way behind what they were even 2 or 3 years ago. And so families are having to pull out all the stops and fill those gaps. And I would like us to be able to influence, by using those individual experiences like Stephanie, to actually influence and be valued by the people who are planning services, and to get them to understand the importance of this condition, that it is a big killer. It's more so important than stroke and heart disease put together.
And actually, just before we move on to Carol, let's just continue that a bit further. Barbara, why do you think that is the case? Do you agree with Jean that perhaps the priority for dementia has been sort of lowered slightly before COVID? Is that something that you experienced as well and saw?
I think there are several issues here. One is about people being identified. So there's been a strong push over recent years, for people to come forward and be diagnosed earlier. And the basis of that is obviously if people are, if it's known that somebody has dementia, they still have mental capacity, they're still able to contribute to the planning for their future and make decisions that affect the way in which they will be cared for in the later stages of dementia. And the diagnosis rate was improving before the pandemic. It's now slipped back significantly. So far fewer people are being diagnosed now than before the pandemic. So I think the fact that health service resources and social service resources were diverted away from care to deal with the issues that the pandemic faced us with has had a detrimental effect. I mean, across the board, but it's especially evident, I think, in the dementia field. And then I think it is about priority. So there have been certainly steps towards improving investment in services for people with dementia and in supporting carers, but that has to be sustained. And it's very much, it's very variable from area to area. So there isn't a sort of a national standard which really ensures that resources are prioritised to support family carers. And it makes so much sense. So, what we've already heard, like if we support family carers, they are shouldering the lion's share of responsibility for their loved ones. And people do generally want to stay at home. They generally want to live in their familiar environment. With the right support, that's possible. But it's, I think in many ways it's harder now. I mean, if I go back over, like Jean, many decades of experience, services are very fragmented, and that was the experience when I started working in this field 30 years ago, and you still hear that there isn't a sort of clear pathway, and people feel they get lost in the system and they don't really know who to turn to when they have a problem.
Yeah, Stephanie, let's hear from you again, because is that reflected in how you feel supported and have been supported? Do you notice that it's very fragmented, and have you, over your time as a carer, have you noticed that you may have had more or less support at particular times? Obviously COVID has affected everything, but
right. I think it is, well, part of the problem is the social services have so many departments involved in caring, and I don't think they are always terribly joined up when you are involved with them, which is why it's so difficult to find your way through and get the help that you actually need. On the whole, I've been fine, simply because from an early point I joined carers two carers groups mainly, and they have been of the most enormous help, because as has already been said, other carers have a wealth of information to help you out with. They can tell you how things might go, even although the way the person you're looking after won't necessarily go that way, then you know roughly what to expect, and it's not such a shock. It's not such a shock when somebody no longer recognizes you, which is what's happening to my husband. I am with him and he will say, I don't know where Steph is. So I say, okay, we'll go and have a look for her. And so he wanders around upstairs. At least that gives him a bit of exercise. And he comes back and he still doesn't really necessarily recognize me, and we have to have a little conversation, and he always ends up saying sorry. He doesn't recognize his family, and so I worried about what shock it would be to my sons that they weren't recognized anymore. It's carers. I do honestly feel that there should be more arrangements for people to meet other carers, like in doctor's surgeries, perhaps, like at leisure centres, which is that's where two of the dementia groups that I went to resided. And you need to have activity. They provide activity in a really pleasurable way. And they also provide the social content. Much more of that needs to be arranged and financed by local councils and the government, because that's where the best advice has been given to me.
Thanks, Stephanie. And you know, I can't imagine how difficult that must be, actually. So you know, and it's obviously incredibly increasingly common for people to have to care and just deal with it on their own. And you know, that's why just talking about it like this is extremely important. So thank you for being here today and for sharing. Carol, just coming to you now, you know, a little glimmer of hope on the horizon is perhaps for those with dementia and their carers to be able to get away and spend some time in a supported environment. So tell us more about how you fit into the story in terms of what we've already talked about so far.
So you know what you've heard from you know all the panelists and you know Steph in particular, that is, you know, I was a carer supporting, you know, my mum with dementia, and it became very clear as my dad was spending, you know, more time, you know, he was that person who was spending, you know, over 100 hours supporting my mum and dad, and you know, wanted to be the person to be there for her. And you know, what I learned on that journey was that actually when my dad became stressed, my mum's dementia, she became more stressed. And it became very clear that, you know, we can't really treat the person with dementia or provide the service for somebody with dementia without also providing something for their family carer. And you know, there needs to be services where people can go to groups together, and there's the opportunity, as Steph's highlighted, to speak to other carers, but things need to be set up in a way that the person with dementia is doing something enjoyable, is meeting other people and building up their self-confidence in general. Because, you know, I looked at our family experience, yeah, and my dad was only happy when we went away on holiday as a family if he knew my mum was doing something enjoyable. Yeah. And I used to worry like mad that we might be, trying to get her to do, too much, or introducing something that she might find really frustrating and upset her. So it's really, really important that when there are groups, that you recognise both individuals and recognise how important it is to really understand when people want to do things separately, but equally be really, really mindful. And, when we had the idea of, providing holidays for people to go on together, I went and spoke to lots of carers, and said to them, well, would they rather have time to themselves and their loved one, went into traditional respite, or would they want to, do something different and go away together? And unilaterally, everybody said, no, we want to do things together, but we are apprehensive or uncertain about how we, the last time we went on holiday, or the last time we took the bus into town, or drove into town. It was really, really stressful for the family carer, and they needed maybe eyes in the back of their heads, or realised they had to plan things much more advanced to know where the disabled toilet was, or what shopping route they do, so that they knew that there was a seat because their loved one got tired for a bit. So, what we've set up in mind for you, and I think it's, something that everybody should be thinking about, what are the other sorts of activities that we can be creating for people living with dementia and their carers to do together. So we take very small groups of people away on holiday with us, but before we go away, we really understand exactly what the carer wants to do on holiday, exactly what person with dementia, if they're at that part of their journey where they can share it. We go and visit our guests before they come on holiday, not because we want to know we can do it safely, and all of those things are in place, but to understand what are those concerns, because people are worried going outside their own environment, and there are things that come with the territory with dementia that people can be very embarrassed to speak about. Incontinence for most of our guests is something that they're really worried about. Going away, staying somewhere nice, what if an accident happens? Can I wash the clothes? What if I ruin the mattress? All these sorts of things, which, yes, are concerning, but for us, they're all things that are perfectly manageable. And for somebody with dementia, worrying about where is that toilet, will I get there in time, those are things that we can pre-plan. We know we always meet somewhere for lunch on a Monday. We know where the toilets are. We've asked for seating at a place that isn't next to a very, very loud coffee machine, which are all the range. But for somebody with dementia, loud noises can be, really disturbing. So, it's about taking the time to understand what individuals want and allowing them to continue to do the things they've always done, which isn't, I don't think, a responsibility of health and social care. I think it's a responsibility of society to be able to either have activities where people with dementia and their carers can enjoy together. And we've had some lovely examples. We introduced a couple to pétanque on our holiday, because one of our staff members, he coaches the GB juniors in pétanque. So when he comes on holiday, it's always something we do. They loved it. They went back and they joined their local pétanque group. Not a dementia group, but that's for me. It's as much, yes, we need a more joined up health and social care system, but we need to think out of the box about how we can, get people with dementia and their carers to feel more confident in doing things with their community, but equally, how can we create environments like ours where it's just us and the holiday property. There's no judgment. There is support and understanding. But
Carol, can I sorry to interject, tell us how you're planning to scale up what you're doing, if I may.
So for us, it's about being able to book, first and foremost, the properties that we need, that are dementia friendly, and have all the facilities that provide a relaxing environment. And that takes a significant amount of money to be able to secure those properties. It's also about making people realize they can still go on a holiday. A lot of people think that last holiday was dreadful. It's not going to happen again. It's about using the knowledge that we've learned over the 6 years that we've been providing holidays, that people understand, well, actually, we can still go on a holiday ourselves, but there's things I would ask, like, are there spare sheets in my hotel room in case there's an accident? I would research where I'm going. I'd think about the sorts of food. So it's about sharing information so the community can still go on holiday, but also realizing, coming with an organization like ourselves, we can give that extra support so that people don't have to worry about the day-to-day routines. So it's about scaling up our organization so we can take more people on holiday, have the appropriate staff, because at this moment, we're a very small organization and we're limited on how many people we can take on holiday based on our size and the requirement to grow more. So that's...
Thanks, Carol. And Barbara or Jean, coming to you, how does this fit into a set of support services for families? Obviously, this is one element of being able to provide, like we said, a break and a sort of giving people confidence. What else should we be doing? And what else does your work contribute to this? Jean, maybe to you first.
Yes, from Tide's perspective, we were set up as an involvement network, basically, to use and to listen to the voices of carers, because we recognise that they are the experts. They're experts by experience, and everybody's story is unique, and they are powerful stories that need to be listened to, but also valued. I think that's where we've still got quite a bit of work to do in terms of people responsible for making decisions, as I said earlier, should listen to what carers need. Often decisions are made by professionals without listening properly to those voices. And often carers have got very simple ideas that are not very cost effective either. I think there is often a fear amongst professionals in health and social care that if you listen to the people who are involved, the patient and the carer, or the client and the carer, they might want very expensive things. And actually, the reality is not there at all. And very simple solutions can be made if only they would listen and engage. And so what we try to do within Tide is engage with carers who want to be involved and use their experience. Not everybody does, but for those who want to use their experience to make a difference for others, we will provide some training through our carer development programme that provides training and development around skills, knowledge and confidence to be able to use your own personal story with impact and to influence a change for others. So we have had carers who've been directly involved at government level. We've just launched with our carers in Scotland a particular resource that is relevant to the whole of the UK, but it was funded by the Scottish Government with our tied carers in Scotland to actually look at resources for re-establishing those relationships with care homes, because over the last year that has become so difficult, where carers have not been able to go in and visit their loved ones in care homes, and relationships that might have existed prior to the pandemic have suffered. So we've established and launched only last week new resources to help both care home staff but also families to re-establish those relationships. And that was a direct influence from the Scottish Government, and the Welsh Government are now following suit. In Northern Ireland, we've got carers who've contributed to a carers handbook just being launched about local services. And we have to recognise across the UK that the different administrations work very differently in terms of policy and the way they fund services. So although we have carers across the UK and they work in those different countries, we also bring carers together through our various programmes where they can learn from each other, as has been mentioned already, through peer support in those. So we'll provide some training and development for carers who want to be involved, who want to make a difference, but also who want to help other carers through peer support. And so a number of different focus groups with different particular topics will come together to talk about that. So if you've got carers of people with young onset dementia, they want to talk to other carers in the same situation, not talk to people who are caring for someone in their 80s, for example. And so they've been working together and are linking with other organisations to have a bit more leverage in terms of trying to influence the change and support for more services locally.
Thank you,
so they're just examples.
Yeah, great. And Barbara, to you, how does Dementia Pathfinders fit into the puzzle?
Our work dovetails very closely with some of the principles Carol has been outlining. So we are focused very much at local level with partner organisations, concentrating on helping people to carry on with their lives. So to do the things they really love doing. People who are diagnosed with dementia, often they then become defined by that diagnosis, and we're we challenge that and are trying to help everyone understand that a person with dementia is a person, that everybody is an individual, they're a person with their life history, their talents, their skills, their interests, and to really focus on enabling people to live the best life they can with dementia, recognising, of course, it is a condition that progresses over time, but to make the very most of the time they have whilst they're well, and helping people to feel that they have a purpose. And we engage with a lot of arts facilitators, so helping people to enjoy music, dance, the arts, the outdoor space, nature. So swimming, sport, anything really that we all love. We all have hobbies. We all have life-enhancing activities that make us feel good. It's the same for people living with dementia. It shouldn't be different. So it is very much focused on the everyday, what happens every day, and how can life be enjoyable every day.
Thanks, Barbara. So I think we have had some questions come through the chat, but you've all been furiously scribbling away back to them. So we may have addressed most of the questions, but if there are any of ones in there that you feel are particularly worth just highlighting to everybody, were there any ones which anyone would just like to talk a little bit more about? I know you've also highlighted some support services as well. Someone was talking about the threat of physical violence in relationships, which is obviously very difficult. And I think you've talked about Admiral Nurses there, Barbara. I don't know maybe it's just worth highlighting what they do, and if you feel able to just talk about that for a second.
Sure, certainly. So Admiral Nurses are specialist dementia nurses. The charity responsible for Admiral Nurses is Dementia UK, and as you said in the introduction, I worked for Dementia UK for a number of years, and Jean was also very involved with Dementia UK. So, and in fact had an Admiral Nurse to support her when her father was living with dementia. And the model is very much around supporting family carers, so focusing on supporting family carers and equipping family carers with skill and emotional support in order that family carers can feel more able to fulfill their caring responsibilities, and primarily in the community, but there are Admiral Nurses working in hospitals, in care homes, and in hospices as well now. So it's some years since I worked with the charity, but if you look at their website, you can see what they do and see that there's been quite a big growth in the numbers of Admiral Nurses. They're not everywhere. So always the response when I say this is, well, there isn't one in my area. That's the case. They're not everywhere, but they do have a helpline, and that helpline runs 7 days a week. And its unique selling point is that if you ring the helpline, you will speak to an Admiral Nurse. So there's no triaging, you go straight to an expert.
Great, thanks, Barbara. So I think most of the other questions we have covered during the conversation and have been answered. But yes, Stephanie, you're saying, do you want to just tell us what you have just responded?
Basically, we carers all need help of one sort or another, but the thing that opens doors very much is registering with your doctor specifically as a carer. You register as a patient, but you also need to register as a carer, and that will often open doors with the surgery about additional help that you can get. Also registering for attendance allowance. Attendance allowance also opens doors to other services. Registering with social services for care that you need or anything else, that also opens doors. So you might be thinking that perhaps you don't need that much help at the moment. But the problem is that until you register, you don't know what help is available and whether or not you could actually use that help. Part of the problem is that carers tend to be unaware of just how much they do. And until you have to actually sit down and write it down when you're doing an attendance allowance application, it's really, really difficult, because you do all these mundane things from hour to hour, minute to minute, day to day, and you don't even know that you're doing it. It's just automatic. And so I'd say certainly for attendance allowance, what is really important is to sit down with somebody else, like at the local advice centre or one of the charities, because they will take you through what you do, and they will open your eyes as to what you do. And also, when you put all that down in your application, it could make a big difference as whether you get the smaller attendance allowance or whether you get the full one. And I can tell you categorically that if I had not sat down with our local advice centre, I would not have got the full attendance allowance for Graham. It's really, really important to pay a lot of attention to that. And any kind of registering you can do, register.
Thank you, Stephanie. I think that is excellent advice to finish with, and you know, first-hand experience, which is also incredibly important. So just to finish off our discussion today, I'm just going to come back to Carol again, just to give us that you know, closing thoughts, and also, you know, just her vision for the future for Mind for You, which is what brought us all together today. So over to you, Carol.
So yes, I mean, what a great discussion, and hopefully everyone that's listening now and people who listen to this when they play the recording really understand just how important family carers are. And, you know, who cares for the carers? Well, we should all be caring for the carers and the person living with dementia. So it's important to think of dementia as the person living with the dementia and the person that's supporting them. And we need to recognise that we provide services for both individuals as well as the individuals by themselves, and that they're done in the way, as we've highlighted, the carer understands most how you support that loved one with dementia. And, you know, in growing Mind for You, we want people to recognise that, as Barbara's highlighted, the importance of continuing to do the things you enjoy. People think people with dementia only like speaking about things in the past, only like looking and listening to music that they've heard in the past. That's just not true. People with dementia can enjoy new things. They may not remember that they've done it, but that couple can still enjoy new experiences. And I think that's what I want, you know, people to realise with Mind for You, that, gosh, that's a group of people on holiday. They're enjoying themselves. It's not there's somebody with dementia being taken on holiday. And it's about really recognising, no, nobody wants that diagnosis of dementia, but with the right understanding, the right support and the right services, both health and social care, but also choices of other services that we all have to pursue a hobby, that actually we can support people with dementia and potentially people with other chronic diseases in a very, very different way. So it's about realising people, I think Barbara put it, they're all individuals, just like every one of us, and we shouldn't be defining people with their disease. And I hope that that's what people see from what Mind for You do. Certainly our photographs or holidays, you can't see who has dementia or not. It's people enjoying themselves. And that's what we need to provide with chronic illnesses and for those family carers who are doing a phenomenal job.
Thank you, Carol. That's a great way to sum up. And I just want to say thank you to you, Carol, Jean, Barbara and Stephanie, to bring your wealth of experience, your first-hand experience and knowledge to the discussion today. I certainly feel like I've learned something, and hats off to all of you for the amazing job that you're doing. And good luck to Mind for You, who are very soon, hopefully, going to pass their minimum investment on FX. And I hope you quickly accelerate towards your target so that you can do a lot more of the good work that you're doing. So thank you, everyone. Thank you for listening today. We'll send around the recording of the webinar and the links to the extra information which have been provided today, which thank you all for all your contributions. So thanks again and have a great day. Carol?
Just to say thank you for Ethics for really highlighting an area of dementia that isn't often discussed so openly with a group of people who have real lived-in experiences in caring. So thank you.
Oh, thank you. You're very welcome. Okay, lovely. Have a great day, all of you. And I hope that we'll get a chance to have this discussion again one day. All right. Thanks very much. Bye-bye.